What is acetaminophen/aspirin used for and how does it work? Acetaminophen/aspirin is an over-the-counter, OTC, product used to relieve minor pain caused by headache, muscular aches, fever, minor arthritis pain, and colds. Acetaminophen/aspirin is available under the following different brand names: Goody's powder back and body pain and Excedrin back and body. What are the dosages of acetaminophen/aspirin? Dosages of acetaminophen/aspirin. Dosage forms and strengths. Oral powder, Goody's powder back and body pain. 325 mg/500 mg. Caplet, Excedrin back and body. 80 mg. 120 mg. 325 mg. 650 mg. Dosage considerations should be given as follows. Analgesia/fever. Indicated to relieve minor pain caused by headache, muscular aches, fever, minor arthritis pain, and colds. Adults and children over 12 years, Goody's powder back and body pain, 1 powder on the tongue, or mixed in water or other liquid, orally every 6 hours, not to exceed 4 powders/24 hours. Adults and children over 12 years, Excedrin back and body, 2 caplets orally every 6 hours, not to exceed 8 caplets/24 hours. Children under 12 years, safety and efficacy not established. What are side effects associated with using acetaminophen/aspirin? Common side effects of acetaminophen/aspirin include acetaminophen, angioedema, laryngeal swelling, itchy rash, hives, agranulocytosis, leukopenia, neutropenia, pancytopenia, thrombocytopenia, thrombocytopenic purpura. Liver toxicity. May increase uric acid, chloride, glucose. May decrease sodium, calcium, bicarbonate. Anaphylactoid reaction. Aspirin. Rash, hives. Indigestion, heartburn, nausea, stomach pain, vomiting. Ringing in the ears, tinnitus, high or chronic dose. What other drugs interact with acetaminophen/aspirin? If your doctor has directed you to use this medication, your doctor or pharmacist may already be aware of any possible drug interactions and may be monitoring you for them. Do not start, stop, or change the dosage of any medicine before checking with your doctor, healthcare provider or pharmacist first. Severe interactions of acetaminophen/aspirin include dichlorphenamide, mifepristone. Serious interactions of acetaminophen/aspirin include benazepril, captopril, enalapril, lisinopril, ibuprofen, ibuprofen 4, ketorolac, ketorolac intranasal, lesinurad, lisinopril, masomorelin. Measles, mumps, rubella and varicella vaccine, live. Methotrexate, moexapril, pemetrexed, perindopril, pexidartinib, pretamanid, probenecid. What are warnings and precautions for acetaminophen/aspirin? Warnings. This medication contains acetaminophen/aspirin. Do not take Goody's powder back and body pain or Excedrin back and body if you are allergic to acetaminophen/aspirin or any ingredients contained in this drug. Cautions. Contains aspirin. Children and adolescents should not use for symptoms of viral infections, e.g., chickenpox, influenza, due to risk for Reye syndrome. Hepatic impairment or consumption of 3 or more alcoholic beverages/day may increase the risk for liver damage, associated with acetaminophen, or gastrointestinal bleeding, associated with magnesium salicylate. Do not take with other products that contain acetaminophen due to the risk of additive toxicity/overdose. Avoid with active peptic ulcer disease. Avoid severe renal impairment, i.e., CRCL less than 10 ml/minute. Acetaminophen, risk for rare, but serious skin reactions that can be fatal. These reactions include Stevens-Johnson syndrome, SJS, toxic epidermal necrolysis, TEN, and acute generalized xanthomatous pustulosis, AGEP. Symptoms may include skin redness, blisters, and rash. Pregnancy and lactation. Use acetaminophen/aspirin during pregnancy and life-threatening emergencies when no safer drug is available. There is positive evidence of human fetal risk. Avoid aspirin and nonsteroidal anti-inflammatory drugs, NSAIDs, during pregnancy, particularly in the third trimester because of the risk for premature closure of the ductus arteriosus. Acetaminophen/aspirin is excreted in breast milk. Pregnant or breastfeeding patients should seek the advice of a health professional before using over-the-counter, OTC, drugs. Contraindications. Hypersensitivity, hepatitis or severe hepatic/renal impairment.